Hi, I'm Candace. This is my husband, William. This is also William, our 10-month-old son, who goes by Liam. And we were clients of Lydia for pregnancy, birth, and postpartum. And here's just a little bit about our story. So a little bit about my pregnancy. We were first-time parents, and I wanted an unmedicated birth at a birthing center, but I risked out due to gestational diabetes in my second trimester, so I kind of had to switch gears and find an OB. My original due date was July 4th, and like very early on, my OB was talking induction in 39th week due to gestational diabetes, and it's something I just absolutely did not want. So as my pregnancy progressed, it was just this looming, date of induction that was like fastly approaching. So that's kind of a little bit how my pregnancy went. So the Friday before I actually gave birth, I woke up, had like mild cramping, and I just felt different. And I was like, oh, for sure, I'm going into labor this weekend. I told Lydia that, I told my husband that. And then when it didn't happen, I was just in a bad mood all week. That was the first time I was like officially over pregnancy. I didn't want to be pregnant anymore. So flash forward exactly a week later, on that Friday, I had my final appointments with the specialist, with my OB-GYN, and then I also saw the chiropractor that day, and I got a prenatal massage. That's how I wrapped up, because she had scheduled me for an induction for that Sunday. Same thing, did not want, was trying to completely, utterly avoid. So that, when I went to my OB-GYN, I asked her to, check me, which you don't have to. And then I asked for her to do a membrane sweep, because to my surprise, I was already at 3 centimeters dilated. I was about 70% effaced in -1 station. So I was like, yep, if I can avoid an induction, sweep my membranes. Although she told me, like, I don't think you're gonna make it the weekend anyway, which was fine. That evening when I got back from the chiropractor and the massage, I was sitting on my birthing ball. We were watching a movie, eating dinner, and that's when the cramp started to pick up. I'm like, oh, that's interesting. But she had told me, the OB-GYN told me to ignore them because she said my membrane. She was like, ignore anything for the next 12 hours. Okay, perfect. So by that evening, I'm still feeling all this cramping and just like uncomfortable. And I was trying to go to bed, but I couldn't. I was tossing and turning in the bed. I kept getting up and going to the bathroom because it just felt good to sit on the toilet. And then one of those trips, I lost my mucus plug, and I was just like, oh, okay, I still didn't think it was labor. Like, I wasn't really alerting anybody. I wasn't telling my husband, he was asleep. So I'm just still sitting on my ball, talking to my sister, and then at some point, they started coming and going. So I was like, oh, that's actually a contraction. Like, there's a start and a stop to it. And then I couldn't talk through them anymore. And I'm still not thinking this labor, though, honestly. It wasn't until I ended up throwing up my dinner, I was like, okay, I think I'm actually in labor. I had to start getting on my hands and knees to cope with the contractions. So then I decided to finally start timing them, and they were already like 5 minutes apart. Well, that's interesting. So I called Lydia, told her, granted it's like, I don't know, 3 in the morning at this point. She's like, okay, she's encouraging me to stay home as long as possible, get in the tub, wake up my husband. And so I do that. I told him, like, I need to get in the tub, I'm having contractions. At this point, it was like 5 in the morning. We started timing them again, and now they were coming every 3 minutes, and I just couldn't stay in the tub any longer. And my OB had already told me, like, if you want to come in, because that's all we're going to do. Don't call, just come. So same thing, Lydia was like, when you'll go. So we get in the car and we go to the hospital. We get there right before the doors open. So we had to go through the ED and have like triage come down and get us. So while in triage, you know, they check you, right? And so I was still 3 centimeters dilated. I was now 90% effaced, which was more than the 70, and I was still -1. And they're like, oh, we don't know if we're gonna keep you. We're gonna give you an hour, see how you progress. I look at my husband when they leave, like, we're not leaving. But not even 30 minutes of them checking, I felt this pop and gush of water. And like, I think my water broke. Put the nurse there. She said, okay, we'll come check you again. So they come and check me again. And then, with, like I said, it had only been like 30 minutes had passed. I went to 6 centimeters. I was still -1, but I don't remember I was 100% effaced at this point, but obviously they were admitting me, like it was go time. It took a little bit to get into the room because I requested a tub. Like I said, my goal was to labor without medication, low intervention as possible. So, you know, once we got to meet our nurse, you know, we were telling her all our wishes. I left the birth plan in the car. So we were just verbally telling her what we do and don't want. Up until this point, I had been coping just by like breathing and squeezing my husband's hand during contractions. You know, so the nurse helped me into the tub. And then she goes and checks under the patient, but she's like, you know, let me know if you have to push. I'll come back in. I tell you not, as soon as I got in that water, first of all, I realized now my water was breaking more. And so I felt this gush. So my husband was like, do you see anything in the water? Like, I felt something come out. He's like, no. And I'm like, I feel like I have to push, like, go get them. He was like, where's the call light? He kind of had a freak out moment. And he ended up just running into the hall to find someone to tell them. They come in and get me out. They check me again. And now I'm 8 centimeters dilated. For sure, 100% effaced at this point. And I don't even remember the station. Like I said, at this point, it was just me and my husband laboring. And because it turns out, they weren't showing me admitted in the system. So they wouldn't let Lydia, our doula, come upstairs. But I tell you, I had a contraction on the bed. And I started pulling my husband down. And at that very moment, she walked into the room. And it was just like a relief came over me. Because I think at that point, I could no longer cope the way I was coping. So when Lydia gets there, she gets me out of the bed. We're standing up, leaning over the bed during contractions. She's doing hip compressions. I'm still squeezing my husband's hand. We're just swaying and we're squatting. My water ends up breaking even more on the floor while this is happening. She gets me back into the bed, and we're in like this running position that I could not figure out at first while I'm in labor. Basically like having my leg up to open my pelvis more. And you know, we're on one side and then we flip over to the next side. She said, okay, let me know when you want to be checked again because I'll go get them. I thought about it for a minute and I was like, go get them. Because what was happening, which I didn't even believe it could be true, I was having the fetal ejection reflex. Like my body was pushing on its own, and that had been happening since I was standing up, and it was still happening when I was laying down in the bed. And I'm like, yep, nope, I'm still. So she goes and gets them or calls nurse. I don't even know what happened. There's points in labor where I just like zoned out and I could just hear like background chatter. So they come in, the doctor comes in, the resident comes in, the nurse comes in, and doctor's introducing herself, like, I'm going to go ahead and check you when you get on this contraction. She's like, how do you want to push? Like, on hands and knees. I turn over so she could check me, and he's already crowning. She's like, oh, okay, well, he's here. I'm about to like have another contraction, so I'm trying to like put back to my side to like cope with it, and they're stopped. My husband's stopping me, like, you know, I need to hold your leg. Like, the doctor didn't have any time to gown up. There was no breaking down of the bed. She literally sat on the edge of the bed. I think she, you know, we put on gloves, and she's about to catch my baby. Like, I just remember having a contraction and his head coming out on its own. And then she was like, okay, if you push, we can get his shoulders out. And then I pushed once, and there he was. So how did having Lydia, you know, impact my pregnancy, birth, postpartum experience? Let's start with pregnancy. So first off, like I said, I risked out the birth center. So she helped me navigate and give recommendations to find like the best doctor for me and what I wanted out of birth. So that was great. It kind of took a lot of stress out of that situation. She also kept encouraging me, even though I don't know why I was afraid to like present my birth plan to my doctor. And so she kept encouraging me to have the conversation early and have it often, and you know, never not ask questions. So that was great. During birth, as you obviously just heard our story, like I was going fast. It felt like, but I know she helped it along by getting me up out the bed. I wasn't on my own, you know, by doing hip squeezes. Like those things helped me cope. I never thought about even asking for pain medication. In postpartum, like in the immediate postpartum, in the labor room, like she was the one that helped, you know, assist with our first latch. She was the one helping me like shower and get dressed and just feel normal again. She stayed with us in the room, and so we went to recovery. You know, she was constantly checking on us, you know, the day after labor. I so happened to add on to my doula package and do the extra 6 weeks postpartum. You know, I was really concerned about, you know, my mental state and, you know, based off my own history. And so she followed me every week for 6 weeks, and boy, was it helpful. Postpartum is no joke. Even when you think it's hard, it's even harder than what you think it's gonna be. And actually 4 days postpartum, I had to go to the ED emergency department because we thought we were having some abnormal bleeding. Like I passed a really huge clot, and that was such a horrible experience. Like, of course, everything happens in the middle of the night. Like it's 1 a.m. when I'm calling her and telling her these symptoms and what should I do, and I'm crying, I'm upset, and like she literally checked on me the whole time I was in the ED, and you know, until I got home. Like she was constantly always touching base with me and asking me how I feel and what I need to do. So what do I want other families to know about having a doula? I want them to know that it's not just for the unmedicated, natural, air quotes, birth, you know, birthing at home, birthing center. Like it's for all births, even a hospital birth. I think I was even naive about that until I ended up having a hospital birth. You know, your nurse, is awesome as she is, her job first and foremost is your health and the health of the baby. So vitals and IVs and, you know, checking heart rate, and she has multiple patients to do that for, right? So she can't be in the room the whole time you're going through labor. And that happened with us. Like she left the room and I kind of had a freak out moment with my husband. But it's your doula who's reminding you to breathe. It's your doula who's, you know, doing counter pressure and changing you positions. It's your doula reminding you to drink water, and, you know, like they're your best advocate, and they're going to help you advocate for yourself. So would I recommend a doula? 100% over. Like by far was the best money I've spent on myself in the last, I don't know how many years. Like there's no price for your health and the health of your kid. And the health system, honestly, is hard to navigate sometimes, and it's hard to speak up for yourself. And I'm a, you know, practice what I preach. Like, yeah, I've been through birth once, but every pregnancy is different. Every birth is different. So, you know, when I get pregnant again, I'll be calling Lydia and be like, okay, it's time for round 2. Like, we're gonna do this again, because that's how invaluable I think she was. You know, when I tell my birth story to anybody, I always say I had a doula. I start off with that, so they know, like, I only achieved this because of her and because of the things we put into practice and what we worked on. You know, and I've had some friends who's gone through birth and had some trauma, and I didn't. Like, I had such a positive experience, and this is with me being, you know, before I had a doula, I was just so nervous about birth. I had so much anxiety, you know, about will this be a healthy pregnancy, will this be a healthy birth, you know, will I feel heard, all these things. And like after the experience, I like felt so empowered. You know, I told Lydia, like, you know, if I have it up my way, like my skill will be delivered at home. Like I would love to just have that experience at home with a midwife. Now, will that actually happen? I don't know. But, you know, however it happens, even if it's another hospital birth, like I know going into it what I'm capable of and what I can do. And I think that's just amazing.